right. I greatly appreciate this opportunity to be with you today and share with you what we're doing at Empath Health. Unfortunately, cancer is the second leading cause of death in the United States, in large part because by the time people develop symptoms and get diagnosed, it's an advanced stage when survival rates are dismal. However, if we could find cancer early with screening, before it has spread or gone anywhere, survival rates are much, much better. However, in healthcare today, it's typically a case of too little, too late. National guidelines say we should be screening people to find cancer early, but 90% of high-risk Americans aren't being screened for lung cancer, and a third of us are missing out on screening for colon cancer. Now, this obviously hurts patients, which was our motivation for developing Empath, but it turns out that healthcare organizations are also losing billions of dollars of revenue from all these screening tests that never happen, but more importantly, from the downstream care that never occurs. And if you take a step back and you think about it, for a healthcare organization to increase screening, it's really not that easy. They first have to identify which patients might need a screening test based on data in the electronic health record that's often inaccurate or missing. You then have to somehow notify or reach out to those patients. You have to make sure they need screening because maybe they had a colonoscopy 2 states away and we don't know about it here. And then you have to educate them and motivate them to get screened because let's be honest, when was the last time you were excited to go get screened for colon cancer? And then even once an individual agrees to be screened, scheduling and other barriers can get in the way. So how do we get patients to choose preventive screening? Well, the answer is with Empath. I'm Dr. Dave Miller, founder and inventor of Empath, an automated direct-to-patient program that uses behavioral science to take patients from the very first step through the very last step of this process. And here's the 30,000-foot view of how Empath works. It starts by sending automated text messages to individuals, letting them know there's a life-saving test that they might qualify for and inviting them to click a hyperlink to learn more. Once they tap that hyperlink, it takes them to our cloud app that they use on their own device. They don't have to download or install any software. And Empath asks questions and uses algorithms to determine what they need. It then educates them with a video that we produced, which is based on principles of behavioral science to educate, but more importantly, motivate. And then we let patients request screening directly through our program without ever setting foot in their doctor's office. We wrap all this up and electronically transmit it over to the healthcare system to take action. And because we run external to the electronic health record, it's incredibly easy for us to spin this up, and we can work with any health system out there, no matter what EHR they have or how many different ones they have. Now, speaking of electronic health records, a common question we get is, well, can't my electronic health record do this? And the simple answer is no. If all you want to do is blast out messages through a patient portal that say, hey, it's time for your colonoscopy, yes, you can do that, but it won't be very effective because you're not doing the critical steps that follow, which Empath does. Now, Empath has been quickly adopted by health systems across North Carolina. To date, over 70,000 patients have used one of our first 2 modules for either colon cancer screening or lung cancer screening, and this number climbs daily. Based on our experience, we know Empath is extremely effective. We have multiple published clinical trials, and we know that Empath reaches patients. Over 85% of everyone who hits our homepage completes the entire program. We also know that Empath identifies 3 times as many patients who need a cancer screening service compared to the data that you would find in the electronic health record alone. And most importantly, Empath doubles cancer screening rates. We published a large randomized controlled trial, and we showed that it doubled colorectal cancer screening regardless of race, ethnicity, income, education, zip code, or literacy level. We also know that Empath generates tremendous return on investment for healthcare organizations that use it. By increasing colon and lung cancer screening, we generate about $6.5 million in extra revenue a year for health systems. And in turn, we charge for Empath under a SaaS model where the subscription fee turns out to be a fraction of the additional margin that we're generating. Now, there are a handful of other programs on the market that will let a healthcare organization blast out simple message campaigns. But none of the programs take patients from the very first step through the very last step, and none of them have any evidence that they work. We developed Empath with over $6 million in highly competitive funding from the NIH before we formed our company and spun it out of Wake Forest University. And we have over 12 publications in the nation's leading medical journals showing our effectiveness. The initial TAM for Empath is about $1 billion, but this is conservative because TAM will more than double in the coming years as one, the US population ages, but two, as we move into other disease areas like diabetes management, heart disease prevention, which dramatically expands the population for whom Empath is relevant. We'll be growing Empath over the next 4 years to cover about 4.5 million lives, generating revenues over $50 million. And later this year, we'll be layering on AI, because I was told we had to mention AI earlier. But realistically, because our Gen AI is going to also help us tailor the messaging even more effectively and personalize the outreach. We have the ideal team to pull this off. We have experts in behavioral science, clinical medicine, technology startups. Both myself and my co-founder, Dr. AJ Durad, sitting right there, are board certified in internal medicine and clinical informatics. And we rounded out our team with other individuals who have decades of experience managing, launching, and exiting successful digital health startups. We have enjoyed significant growth and great times in the last 18 months. We recently received an additional $2 million in non-dilutive funding from the NIH to further support our growth. We closed a $1 million seed round just last month to further expand growth, and we're getting ready to go live with our third and fourth customers later this year. So I hope this excites you, and you will join us on our journey to save millions of lives and transform the way preventive care is being delivered. Thank you. And now Peter will come up to take questions.
First of all, I applaud you for doing this because I have 2 people in my life who very recently were diagnosed at a young age, with one with colon cancer and one with lung cancer, and that's could be prevented. Yeah. So thank you for tackling this problem with generative AI.
Yes.
So I'm just curious about the expansion beyond. At what point in time do you see that move to taking on other health issues?
Yes, so we anticipate we have a roadmap of 16 modules we want to roll out over the next 3 years. We're releasing our breast cancer module later on this fall. We have plans for other modules around HIV prevention coming out and requests to move into the diabetes and cardiovascular space. Short answer is within the next year, we'll have a module outside of the oncology sphere.
Very impressive. Congratulations for everything. You mentioned an 85% conclusion for folks who click it. What is the through line, though, for how many you send out? What's that conversion? And you didn't say your community asks.
The ask, yes, sorry. So the ask is we're preparing for a 2025 Series A raise. So we're looking for strategic partners to help us prepare for that 2025 A raise. In terms of going more upstream, a little over 40% of everybody we send messages to come to our platform, and this is where we want in all seriousness, we're with the Gen AI and some other alterations we're making in the messaging to improve that even more. Marketers say we're knocking it out of the park, but we want to do even better than we are now.
Full disclosure, Dave and AJ are part of Winston Stark, so I know a little bit about you guys. Congratulations on the progress in the last 12 months. You've got product market fit on a couple of modules, and you're starting to scale up and add folks. What are the challenges now that you're dealing with versus a year ago?
Yeah, we have come so far in a year. It's been such a fun journey. The challenges now is the long sales cycle of health systems and the complicated nature of health systems. And also the fact that health systems are really busy places with competing priorities and distractions. So it just takes some of our effort to kind of be there side by side and shepherd contracts through these complex organizations. I would say, if you asked me like a month ago, I'd say bringing in the additional help we need, but we just hired another fantastic programmer. We're about to hire another great salesperson to our staff. So the staffing side is coming together nicely for us.
So who's your favorite current investor?
They're just like my children. They're all my favorite.
What's been the biggest surprise to you as a startup CEO, as a startup CEO, especially one that came from a totally different field, practicing medicine?
Yeah, lots of surprises. So I love learning. It's been drinking from the fire hose for the last 2 years. Love learning about the business side of things, managing teams. I think one surprise was how there are surprising parallels between the business world and academic medicine in terms of mentorship and accelerators. What you call accelerators, we tend to call mentorship in our field. Running large, complex science teams with multi-million budgets actually has parallels to managing teams within companies. So that was kind of a pleasant surprise that I could translate a lot of what I carried over. I never expected it to be easy, so we expected the sales cycle to be very long. Maybe I was disappointed that I was right. But beyond that, I take it back. The other big surprise was how quickly we'd be able to grow. So if you asked me, a year ago, would we have as many people in the company as we do today, I would have been very doubtful. So it's exceeded my expectations in how rapidly we've been able to grow. Because of our great investors.